Good morning. We all know someone like Betsy's mother-in-law who has fallen. In fact, I was thinking as she was talking, my mother lived at home. I was gone, and my father passed away a number of years ago. And she was taking a bath a few years ago and fell in the bathtub and broke her leg. Well, that was before she had one of those little call buttons. So she sat in the bathtub from probably about 9 o'clock until about 6:30 the next morning, when the neighbor was walking by her house and heard her yelling for help and called me, and we went over. And she wound up having an operation, being in assisted living, and she was never the same after that. She had a walker and in a wheelchair, and then she wound up being totally immobilized. And it totally changed her life because we didn't have any grab bars. We didn't really know how to set up her house to protect her from falling when that was probably, as we've heard today, something that was inevitable. Because I believe deeply that we have a role to play in preventing injury and illness, not just treating it, I am wholeheartedly in favor of supporting healthy aging programs like Stepping On for fall prevention to keep people healthy and independent as long as possible. Research and proven healthy aging programs are a great investment for Wisconsin that helps avoid long-term care costs. I am proud that Wisconsin is a leader in falls prevention and appreciate and congratulate the CDC, WIHA, and the state and local partners, including the many volunteers who helped deliver these programs. I was first appraised of Stepping On when some constituents of mine we met at in the basement of the R-Ripon library. They were volunteers, and they were talking about this program, and it sounded very intriguing because they were volunteers, they taught classes, and it was all research based, and they had great results and outcomes. And they put me in touch with Betsy, and if you know Betsy, she's like a dog on a bone. She doesn't ever give up. And so we met many times to figure out how we could put some money in this last state budget for programs to reduce falls. And one of the things that was sort of amazing is when we met with the department, they were skeptical because they said, well, that isn't much money. How do you think you're going to get the kind of results that you're talking about with not that kind of money? They're used to spending, hundreds of millions of dollars for things, and we had to convince them that there was volunteers that did this work, and there was serious outcomes that were improving people's health, and it was a great investment. So it was sort of interesting because their skepticism was that this doesn't cost much. How can it be any good? And there are programs like that, and this was one of them. I hope that more healthcare providers will offer screenings like the study tool to their patients. I encourage older adults to get screening, and if assessed to be at risk for a fall, take these Stepping On workshop or other fall prevention programs in their community. I introduced legislation this past biennium that provided funding for health promotion programs, including Stepping On, and committed to working with the governor and legislature in the next budget to make this investment a permanent one and increase funding. In reality, if we don't spend some money on prevention, we will spend